Hey everybody. So this next video here is going to be specifically talking about bone disorders, more specifically bone breaks and how we heal them or how your body heals fractures within the body. So that said, when healing fractures, there's a few steps that go on within the bone. As you can see here with this image, this is one of those videos where I go back and forth. And there's four major steps that we're going to talk about. The first is at the site of the break when it happens. So when a fracture first occurs, the first thing that's going to happen is your body's going to create a hematoma because all those torn blood vessels are going to bleed out. So with that said, you're going to create a hematoma right here within the blood, within the bone. So you're going to have this big hematoma. From there, as time moves on, your body's going to start to form granulation tissue within the area, and new blood vessels are going to slowly start to try to form back. And this is going to be the foundation for the new bridge between both sides of the broken bone. So, in other words, we're going to start to see this little bit of granulation tissue start to form within here, which is going to result in some spongy bone growing in here, and it's going to be the bridge between both sides of that broken long bone. That said, a few other things are going to happen within here. One of the big ones is going to be the introduction of macrophages and other types of fibroblasts, which are going to give rise to one. Macrophages are going to break down any type of pathogens or broken down bone or other types of debris in the area that just need to be out of there, right? It was a broken bone, so there's damaged tissue. Macrophages are going to clean that out. Not only that, but there's going to be active osteoclasts within the area because the osteoclasts are going to break down that dead bone, that broken bone. So that way we can clean it out. Not only that, the fibroblasts are going to migrate to the area. They're going to join in and they're going to start to form these new collagen and new bridges between the bone, just like we talked about. From there, this is going to continue. We're eventually going to have some spongy bone form because of all the fibrocartilage coming to the area, forming all those initial bands to create that bridge between the two bones. That's going to start to calcify, turn into some spongy bone, and from there, it's going to continue to solidify and solidify until eventually we have this bony callus, is the name for it, where we're going to have this new section in between the two bones that will bridge the bones together and create the first new link, the new segment of bone. That said, this bony callus is going to be the replacement for all that fibrocartilage, the initial bridge between the two bones. And because of that, it's not going to be extremely strong at first. It's going to take some time. So, slowly over time, as new osteoblasts come into the area, they start to turn to osteocytes, they start to create that new bone. We're going to eventually see a brand new bone, a brand new section to the bone that is completely solid. As you can see in this image, it's not perfect. You see these little bumps on each side. This is indicating that there may be a little excess. And so therefore, osteoclasts will come into the area and start to clean off those bones to make it look as close to original as possible. So with that said, sometimes when there's broken bones, as some of you may know, there's a little more to it than just, oh no, I broke a bone and now let's let it heal. Sometimes we need to put those bones back in place, in a way so that the bones are stable and that they are in a line. So, for example, if we're looking at this bone here, if it's broken and the top part's slightly off from the bottom part and it's not perfectly in line, right? They're slightly out of line, so maybe off a little high, a little wide. Maybe they're just completely overlapped, right? We may need to go in there and intervene and lock these bones so that they're straight again, so that they heal correctly. A couple of ways of doing that, if it needs to be done. The first one is called close reduction. This is when you don't need surgery. This is going to be done outside the body without actually intervening within the body. The second one is open reduction, and this is when you actually need to cut into the body and go in and move those bones around. A lot of times when there is open reduction, what happens is you need to use pins and plates in order to hold those bones in the same spot, because if you don't, they may start to slip, and that's not what we want to happen with the healing of the bones. We want it to be perfect. Last thing here is just a term, orthopedics, and this is the branch of medicine dealing with injuries or disorders of the bones, joints, and muscles. So with that said, this is the end of bone disorders, specifically the end of how to treat fractures. If you have any questions, please let me know.